David, to put this whole event of today in context, exactly a month ago, Nehawu came out, of course, to announce that they were going to embark on a program of action to highlight the fact that the health care workers in this country are suffering on the front lines, and they are getting exposed to COVID-19, and some of them are dying as a result of the lack of protective personal equipment in many hospitals around the country. At the time, 1 month ago, 108 healthcare workers had died. Today, as of this morning, that number has gone up to over 200 from what we understand. But right now I'm joined by the spokesperson of Nehawu, Kaya Klaba, to quickly tell us about today's event. Kaya, thank you very much for your time. Today, what's the significance of your event today exactly?
Well, basically, there's two significance of today's event. One is to honor the memory of those workers who have lost their lives in the line of duty. Those workers who constituted our first response to the virus, the workers who formed the bedrock of our national response against the virus. So we want to say we have not forgotten them. They were part of workers who are fighting hard against the invisible enemy. And two, the aim of the event is to hold a prayer session for those workers who are still working, want to ask for protection from God to protect them against the virus, because we know of the conditions that they're working under. We know they're working under life-threatening conditions without any form of protection. So one protection for them, while we're asking for protection from God, we'll also be fighting for protection in the terms of PPEs and safety and health regulations in the workplace.
Well, as we can hear from the speakers, the event is now getting underway. Quickly, your program of action is unfolding, of course, leading up to on the 10th. What's going to be happening in the coming days?
Well, basically on Thursday, which is the 3rd of September, we're having our National Day of Action, where we'll be marching to the union buildings to deliver a memorandum to the President. But there will be other memorandums also sent to the National Parliament and the 9 Premier Pro offices all over the country to say that this is our demands. That speaks to the issue of the implementation of Resolution 1 of 2018 in relation to the salary increase of public servants, and then the issue of PPEs and many other issues that our workers are dealing with even before the pandemic. Then if government doesn't respond positively to those demands that we would have submitted on Thursday, then on the 10th we'll be left no option but to go on a full-blown strike where we'll down our tools and not work until government fixes those issues that we feel that are urgent and necessary.
Well, thank you very much. I'm going to release you now to go and join the event. Well, Arabile, as you can hear, the event is getting underway now. I understand that this hospital, Baragwanath, is the biggest public hospital in the southern hemisphere, with about 7,000 healthcare workers who work here at the front lines, of course, of fighting the coronavirus pandemic. It's back to you now.